This article is present by the students Catalina Caicedo, Paola Rojas, Chelsea Wandurraga, and Paola Garcia. This article is called Any Global Definition of Acute Respiratory Distress Syndrome. Consult Magazine PubMed. Subject, intervención 3.
Although the 2012 Berlin definition of acute respiratory distress syndrome (ARDS) have been widely used in the clinical practice, uses have occasionally been revised regarding Victor's criteria. Science was proposed had followed nasal oxygen, which widely used to provide effective respiratory support in acute respiratory failure. As patients who do not require ventilation but meet the Berlin criteria have similar characteristics to those with RRDS, the definition of RRDS can be explained to include patients requiring HFNO as PaO2. FO2 underestimates the diagnostic of RRDS. Evaluate of greater than or equal 350 rendered that PaO2 if O2 evaluate on greater than or equal to 300 may be considered to diagnose the condition in resource-limited settings. In this context, patients with severe COVID always meet ordered RRDS criteria expert 7 days. Therefore, the period to the oxygen of RRDS may be extended to the up 14 days. An experimental definition of RRDS may allow early definition of patients with less deserved disease and facilitate testing on implementation of new therapies in patients of high risk for poor outcomes. Here with discussions that may controversies regarding the extension of the definition of RRDS with the view in the improving clinical implementation and patient outcomes. Acute respiratory distress syndrome or RRDS can be defined as condition characterized by the absence of respiratory factors result from the injury to the lung parasympathetic inflammatory nature, compromise the alveolar capillary barrier, determinative, among other things, the information of edema and cold. Furthermore, the histopathological picture can progress to diffuse alveolar damage since its original description in 1960 at Phil 56 years ago. There have been controversies regarding its definition, thoracotomy, and grouping under the levels RRDS of different combinations and etiologies that share similitudes. Therefore, this consensus document, prepared by Tier 2 Critical Care and RRDS experts for various regions of the world, will be present at the main symposium of the American Thoracic Society concerts at May 24 in Washington, D.C., USA. Their main arguments for the new definition of RRD are present below. 1. Inclusion of the need for respiration support with high follow nasal cannula render the 3 letters about minus of the need for CPL, PRNLB with positive pressure of the end of expiration under 5 centimeters the water for non-intubation patient. 2. Inclusion for the oxygen saturation score about in party thoracic exhibit floor rest radio greater than 315 with oxygen saturation score greater than 97% as an alternative criterion of the saturation score about inspiratory thoracic exhibit and floor square radio. 3. Inclusion of long ultrasonic permitted by trained professionals to evaluate the presence of bilateral pulmonary infiltrates. In situations with limited access to resources, rule of the need for criteria such as the need of positive pressure at the end of expiration have followed of the use of a specific respiration support devices.
Taking into account that CRDA was considered insufficiency syndrome, which clinically severe respiratory impairment, acronym 21 global seizures screened and tasked with developing criteria for a conceptualization, having different sessions the conceptual model, which helps as diffuse and acute inflammatory and injury, which increases permeability, risk factors, pneumonia, not pulmonary, infection, trauma, hypoxemia, and pulmonary edema. Difference between Berlin and global definitions. Berlin is RDA, which lateral analysis indicates that Bolarer X-rays and CT scans are the overall indication is that ultrasound identifies viral land irritations, lasses, tube and not tube categories were also identified indically modifications. It is assumed that seizures are limited.
Question based on the article. What is the Berlin definition of acute respiratory distress syndrome? What are the proposed suggestions for a new definition of distress syndrome? What are the main controversies regarding the extension of the definition of distress syndrome? How can the diagnostic of a distress syndrome be made in resource-limited settings? How can lung ultrasound be used in the evaluation of distress syndrome? In conclusion, in the practical scenario, we propose a new global definition of distress syndrome that builds on the Berlin definition. The recommendation also identify areas for future research, including the need for prospective assessment of feasibility, reliability, and prognostic viability of the proposed global definition.
The goal was to develop and definish that one will identify patients with the currently asset conceptual from frameworks for arts. To facilitate rapid heart diagnosis for clinical cure and research. Three, view applicable in resource limited environments. Four, be useful for testing specific therapies. 5, be practical for communication with patient and caregiver. Author, we have Michael Amatai, Jason Aravid, Alejandro Arroliga, Gordon Bernat, and Laurent. André Bester y Laurent Brochat.